Hello everyone, today we'll be discussing drugs used for diabetes, their mechanism of action and the side effects. So when we talk about oral anti-diabetic drug classification, we've got insulin sensitizers, we've got insulin secretagogues, we've got drugs that reduce the intestinal absorption of glucose, and then we've got drugs that increase the excretion of glucose from urine. So what you need to know is the purpose of all these classes is to reduce the levels of blood glucose in the body. So when we talk about insulin sensitizers, we've got biguanides, which is metformin, which is a very common drug, and then we've got thiazolidine diones. An example is pioglitazone. Then insulin secretagogues, we've got sulfonylureas that include glipizide, glimepiride, glycoside, and glyburide. Meglitinides include rapaglinide, nataglinide, and dipeptidylpeptidase 4 inhibitors, which include sitagliptin, saxagliptin, linagliptin, vildagliptin. Then we've got drugs that reduce the intestinal absorption of glucose. So these are alpha-glucosidase inhibitors. Examples include acarbose, voglibose, miglitol. Then we've got drugs that increase the excretion of glucose from urine, that are the SGLT2 inhibitors. Examples include dapagliflozin, empagliflozin, canagliflozin. Then those were the oral drugs. Then we have injectables, which are our insulins. Okay, so compounds include human NPH, human regular lisproaspart, and so on and so forth. So what's the mechanism? So these activate the insulin receptors. They reduce the disposal of glucose and increase hepatic glucose production. So the benefits of insulin is they're universally effective. Theoretically, they have unlimited efficacy. They reduce microvascular risks, and they have variable costs. The side effects or disadvantages include hypoglycemia, weight gain, mitogenetic effect. They're injectable, so you need to continuously be injecting them. Patients need to be trained. Then some have a stigma that this patient uses insulin, so there is like a stigma against using insulin. There is a separate video discussing insulin, the various types, the mechanism of actions, and so on. In this video, we're going to focus on the oral hypoglycemia drugs or oral anti-hyperglycemic drugs. So we'll start with the GLP-1 agonists, which are exenatide, extended release, liraglutide. Mechanism of action is they activate the GLP-1 receptors, increase insulin secretion, reduce glucagon secretion, slows gastric emptying, and increase satiety. Advantages include does not cause hypoglycemia, cause a reduction in weight. They say this potential for improved beta cell mass or function, and they have cardiac protective actions. Side effects include, so they're mostly GI side effects, which are nausea, vomiting, C-cell hyperplasia, medullary thyroid tumors in animals have been noted. They're injectable, they're training requirements that are needed, and they're costly. Then we go to the next class, which is biguanides. An example includes metformin, which is a very common drug. These work by activating AMP kinase and reduce hepatic glucose production. Advantages include extensive experience, does not cause weight gain, does not cause hypoglycemia, likely reduce the risk of cardiovascular disease, and they're of low cost. Side effects include diarrhea, cramping, lactic acidosis. Risk, however, is very rare. Vitamin B12 deficiency. So it has multiple contraindications, which include chronic kidney disease, acidosis, hypoxia, dehydration. The next class is sulfonylureas. Examples include glibenclamide, glipizide, glycoside, glimepiride. The mechanism of action is they close the potassium ATP channels on beta cell plasma membranes and increase insulin secretion. Advantages include extensive experience, reduced microvascular risk, and they are of low cost. Side effects include they have potential to cause hypoglycemia, they cause weight gain. They say sometimes that they can blunt myocardial ischemic preconditioning, and they have a low durability. The next class is the glenites or the meglitinides. Examples include repaglinide and natechlinide. These close potassium ATP channels on beta cell plasma membranes and increase insulin secretion. Advantages include postprandial glucose excursions and dosing flexibility. Side effects include hypoglycemia, weight gain, and querying blunting of myocardial ischemic preconditioning. The next class are the thiazolidinediones. Examples include pioglitazone and rosiglitazone. They activate the nuclear transcription factor PPAR gamma and increase insulin sensitivity. Do not cause hypoglycemia, they are durable. They reduce triacylglycerols and reduce cardiovascular disease events. Side effects include weight gain, edema, heart failure, bone fractures, including increase in LDL cholesterol, increase in risk of MI, increase in risk of bladder cancer, and they are of high cost. The next class are the gliptins, which are the DPP4 inhibitors. Examples include sitagliptin, vitagliptin, saxagliptin, linagliptin, allogliptin. Mechanism of action is they inhibit the GPP4 activity that increases postprandial active incretin concentrations. They increase insulin secretion and reduce glucagon secretion. Advantages include they do not cause hypoglycemia, they are very well tolerated, and they do not cause weight gain. Side effects include generally modest HbA1c efficacy, urticaria, recurrent pancreatitis, and they are of high cost. Then the next class is alpha-glucosidase inhibitors. Examples include acarbose, miglitol, voglibose. Mechanism of action is they inhibit intestinal alpha-glucosidase, slow intestinal carbohydrate digestion or absorption. Advantages include they do not cause hypoglycemia, reduce postprandial glucose efficacy, reduce cardiovascular disease events. Advantages include generally modest HbA1c, GI side effects, frequent dosing schedule, and modest cost. Amylin analogs, an example is pramlintide. They activate the amylin receptors, reduces glucagon secretion, slows gastric emptying, and increase satiety. Advantages include they decrease the postprandial glucose excursions. They lead to a reduction in weight. Disadvantages include they cause a modest HbA1c efficacy, they have GI side effects, hypoglycemia unless insulin dose is simultaneously reduced, they are injectable, frequent dosing schedule, and they are of high cost. And we have the SGLT2 inhibitors. Examples include the gliflozins, which are canagliflozin, dapagliflozin, empagliflozin. They block the sodium glucose co-transporter 2 in renal tubules. This reduces glucose reabsorption in the kidney and decrease in serum blood glucose level. Advantages include they decrease weight, improve A1C, lower BP, can have good impact on decreasing CVS events, low risk of hypoglycemia. Disadvantages include you need to monitor renal function. They're generally well tolerated. They may increase the risk of genital fungal infection and UTIs, and they may increase the risk of euglycemic TKA. So this is just a basic summary of the classes we talked about, an example, and the adverse effects of the drugs. That's all about anti-diabetic drugs. Thank you.